Hey everyone, in this episode of the Need to Know Show, we're going to talk about bilateral knee replacement surgery. What are the pros, what are the cons, and is it something that's right for you? Hey everyone, so today we're talking about bilateral knee replacement. So basically getting both knees replaced at the same time in the same surgery. Now, something that's very common nowadays is staggered bilateral knee replacement. So getting the one replacement, waiting a matter of maybe 12 weeks, a couple months, and then having the second knee replaced. So kind of a staggered bilateral replacement, which kind of gets the best of both worlds. So what are some of the positives? What are some of the pros of a bilateral knee replacement? Well, one pro is that it's all done in one shot. So one surgery, one course of rehab, get it done. So basically that means avoid having to go back for a second surgery, avoid having to go through rehab, weeks and months of rehab a second time. Just do it all in one shot at the same time. So that can save you some time. It might also save you some financial costs. Then there's also some benefits of doing just the one surgery, means less time having to be under anesthesia, having sedation, and having those potential risks of surgery. You're just having the one surgery. It's a little bit longer, of course, because you're doing both knees, but it's shorter and less risk and less time under sedation and things like that compared to two separate surgeries individually. And also, when you think about bilateral knee replacement, so if you were to get a unilateral replacement and you're trying to rehab and recover when you still have knee pain and arthritis in the other knee, and you're starting to put a lot of stress and pressures through a knee that you're waiting for surgery, that might cause some impediments in your recovery and rehab after surgery because you had the one knee replaced, but the other knee still needs to be replaced. So that still has pain, swelling, stiffness, and so you can't manage putting that level of stress on that knee that needs surgery as well. Some of the drawbacks of bilateral knee replacement are it's going to be a little bit more intensive type of rehab and recovery. It's going to be more painful, probably a little bit less mobility. You might have more likely to use a walker a little bit longer, use a cane a little bit longer, just because you're dealing with two sides of your body that are painful and swollen and stiff and are recovering and healing. So that's one of the negatives. Also, the surgery is, of course, going to be a little bit longer. So possibly having a little bit more blood loss, having a little bit increased risk in that nature of just having a longer actual surgical procedure, even though it is just one instead of two separate procedures. Again, I think in the long term that what we're seeing more and more is the staggered bilateral knee replacements. So having the one surgery, rehabbing, recovering, spending at least 12 weeks, maybe 6 months or so, rehabbing and recovering from that surgery, and then already having planned and scheduled the second surgery to have the second knee done. Seems to be that people tolerate that a little bit better, a little bit of less overload and stress all at one time on the body to heal and to recover. I'd love to hear what your comments are, what your thoughts are. Are there any other pros and cons that I may have missed or didn't discuss or comment on? Is there anything in particular that you found with your surgery, if it was a bilateral or a unilateral or a staggered bilateral knee replacement? I'd love to hear, so please leave a comment and let me know. Or if you have any questions about this as well, please let me know in the comments. Thank you very much for watching, everyone. Have a great rest of your day and take care.